The CSDB logo with a collage of 9 videos in the background zooms out and fades to a solid white background. Title: Interventions for Autism Spectrum Disorder with Children Who Are Deaf, Hard of Hearing. Deborah Mood, Ph.D., licensed psychologist. A split screen shows a sign language interpreter on the left, and on the right, our presenter, Deborah Mood, is sitting in front of a solid background. Captions are below on screen. Part 2.
I'm going to talk generally about this idea of an intervention targeting increasing visual supports. So visual supports is a broad umbrella term to talk about different cues that can provide the child with information about what to expect, what the activity looks like, about a routine, or to support teaching them a new skill. So this can include pictures of actual objects.
Graphic: a page of 15 black and white board maker symbols is displayed.
It can include some of those black and white pictures that represent the actual object. It could include objects themselves. So for children who developmentally don't quite have the understanding that pictures represent objects, it'd be more appropriate for them to use an object representing what actually is about to happen, like using their snack placemat to represent snack time versus using a picture that says snack time. It also could include, for older children at a more advanced level, things like a written task list that shows what is expected of them.
Graphic: 8 sequential pictures are displayed of a young boy brushing his teeth.
Visual supports have been integrated into treatment for autism spectrum disorders for a long time and can be really helpful in helping to organize the environment. So for example, using a picture to show this is where we go for snack and having a snack picture. Using pictures to show this is Johnny's work basket versus this is Tamara's work basket. Visual supports can also be used and are helpful in showing what's the routine, what's expected. I'm going to show an example of that. So here's an example of a visual routine that shows what do we do when we get to school. And you can see it shows we put our coat on the hook, we hang up our backpack, we take out our lunch, and then another one that's supposed to represent putting lunch away. So again, these can be used to kind of systematically teach what the steps in a particular routine may be. Children with autism sometimes have difficulty both kind of organizing the steps involved in completing a multi-step task like that, and also may be less likely to rely on their peers to give them the cues about what to expect. So these visual routines can be helpful in showing them what's expected of them.
Graphic: a task card is labeled ready to work with 4 line drawings showing take out pencil, take out crayons, take out scissors, take out glue.
We already talked about how visual supports can be used as a communication tool if you're using it as something like PECS. It's important to think through how you're using this visual support. Are you using it to help increase the child's understanding of what to expect? An example of that is that routine that we just showed, where you're trying to increase the child's their understanding of what's about to happen, versus using visual supports as a means for the child to communicate to others. PECS is more commonly used and as an example of using pictures for the child to express or communicate what they want. Visual supports can also be used to help with transitions. For children with autism, transitions are very commonly difficult. So shifting from playing what they wanted to play to what the adult might be asking them to do. And so part of that is that they may not be as aware of or have an understanding of what's about to happen and what's expected of them. So visual support such as this one.
Title: Visual Supports to Assist with Transitions. Simple first then visual support with board maker icons. A photograph of a communication board is displayed. Under the column heading First is a book icon. Under the column heading Then is a bubbles icon.
Which is a commonly used, first we do this, and then you get this, might be helpful. So for the child who just wants to play on the computer, you might say, first we do work, and then you can have the computer and show them that visually, pointing to this and showing them this each step along the way. This is a concept that is abstract for a lot of children with autism, and so sometimes this idea of first this and then this itself has to be taught. And the way that you might do that is by first starting with two preferred things. So a first then board that shows first bubbles and then rockets, two things that the child really likes, right? And then gradually shaping that and teaching them, okay, first this slightly less preferred and then this preferred activity. So if the child really likes bubbles but kind of likes rockets, you might say first rockets and then bubbles to reinforce the idea of if you do this less preferred thing, then you get this preferred thing. And then gradually transitioning to those less preferred activities to more highly preferred activities. None of these interventions themselves are going to be effective if you just throw them out there at the child. You have to really think about where the child is developmentally, what their understanding is, and how you have to implement and teach this strategy to get it going for the child. Once that's in place, it can be a very helpful strategy.
Photograph. A picture of an object schedule shows a child's white sock, a green plastic drinking cup, and a miniature replica of a yellow armchair. The accompanying text reads 1. Dress. 2. Drink. 3. Circle time. Note, if children sit on carpet, carpet piece would be preferable. A photo of a visual schedule shows communication cards labeled sit, puzzle, ball, stop, and goodbye, using board maker icons.
Another way that visual supports can be helpful for children with autism who struggle with changes in their routine is to make a visual representation that the change is about to happen. So in this example,
a photo shows a visual schedule with the title, Visual Supports to Show Changes, with 3 variations of the same schedule, each with the heading of Anna, and each comprised of 3 colored task card pictures. The first shows math, writing, and reading. The second shows math, my schedule change with a red card, and reading. The third shows math, art, and reading.
It shows what the student's typical schedule is like. So math, and then writing, and then reading. And then it shows a change card that shows we're going to have math at our usual time, we're going to have reading at our usual time, but in between there's going to be a change. And then the staff have added a symbol to represent art class to show that that's the change that's going to happen. For a lot of children, that's sufficient in itself to show them, okay, there's going to be a change, and give them preemptive warning about that and what to expect, what's going to actually happen. For some other children, you might have to take it a step further and use visual supports to also teach them how they can handle that change. So I can ask for help, or whatever the case might be for that specific child. Another language intervention or speech-language intervention that I really want to highlight in this presentation is the use of augmentative and alternative communication, or AAC. For children who are deaf and hard of hearing, who have an autism spectrum disorder, clinically what we see often is that at varying points in their development, sometimes what they need to understand language might differ from their ability to express themselves and use language for communication with others. And during that time, while they're learning how to be able to communicate with others, they might need AAC to support their ability to communicate. So for example, for children who communicate, who receptively need and benefit from sign language as a means of understanding what's happening around them, but who, because they have the motor planning difficulties and imitation difficulties that we commonly see in children with autism, it's more difficult for them initially to learn those signs and to reproduce those signs because those imitation and motor skills are challenging. it might be helpful for them to have some support of AAC so that they can use a picture to show what they want, or tap on their device where the device communicates what they're intending to communicate, while still working on building those skills so that they'll be able to eventually develop either spoken communication or sign communication. AAC can take many different forms, from low-tech things like using an actual object to give to somebody else to communicate what they want, to pressing a button that says yes or no, to higher tech forms, like using some of the common apps that are available for an iPad, or some of the sophisticated devices that have been developed for individuals to be able to communicate.
Title: AAC Examples. 3 pictures are displayed on screen. A Mr. Potato Head image is displayed on a tablet computer with the caption Nova Chat 8 by Saltillo with visual scene display. 42 word and picture icons are displayed on the second picture with the caption iPad with iOS Touch Chat app. The third picture shows an 8-message communication device with the caption Tech Talk 8.
So this technology can be used whenever there's an unmet communication need. So when the child has the intention to communicate but is unable to do it using more traditional mechanisms like speaking or signing. The benefit of AAC is that the technology can be and should be highly individualized to the child, and must be used systematically across different environments in order for it to be effective. So sometimes we see that children have a talker, some people refer to them as talkers, but a device that they use in the school environment, but they're not necessarily bringing it home and using it in the home environment, or vice versa. So when AAC is an intervention that's being used, it's really important that there's a lot of collaboration across different environments to talk through where the child is at learning to use it, and to think through how to reinforce using it in different settings. In the school system, it's possible to pursue, if it's felt that a child has an unmet communication need and that they might benefit from AAC. There are statewide AAC committees where they can come to the school and evaluate the child's needs, and then determine whether they would benefit from AAC and work towards getting that in place. There are also private clinics that are available that can conduct these kinds of evaluations, where they evaluate what the child's strengths and needs are and select the device or the technique that's going to be most appropriate for that individual child. Another intervention for autism that's shown some promise is the idea of social narratives. These can take many different forms. Some of the most commonly referenced ones are social stories, which were initially developed by Carol Gray and have a very specific way in which they teach the social story. But the idea behind any kind of social narrative is to describe a social situation in enough detail to highlight what's important and how the child should handle that particular situation. So the idea is to help make overt or obvious to the child the aspects of that situation that they may not be able to intrinsically recognize from their environment. Social narratives can be used to teach a very specific social skill or a very specific behavior. They're usually short, they're highly individualized, and they're often written in the first person from the perspective of the learner. So an example of that might be this one.
Graphic: a cartoon image of 3 children talking is displayed beside a second cartoon of 2 children talking.
Where the children are saying, people ask me lots of questions, I always make sure to answer. Sometimes I don't know the answer, that's okay. When I don't know the answer, I say, I don't know. So this is very specifically working on that social situation that young children with autism struggle with, where they don't know what to say. And so it's teaching them that it's okay, and here's what you do in that situation. I will include some additional information about social narratives in the resource guide at the end of this presentation. I want to talk about school-based interventions briefly in this presentation because school is where children spend a lot of time with the most consistency, with the presence of the most consistent adults outside of their home. And so it's important that we think through how we can systematically build intervention for autism-specific difficulties like social and play skills within the school environment, because it is a natural environment for them. One of the things that we've seen in young children with autism is that they're on playgrounds and in situations at school. When we look at that closely, children with autism are spending less time engaged with their peers on the playground and in school settings. However, children who receive interventions in the school environment that are keeping them engaged with their peers tend to develop more proactive social skills and are more engaged with their peers. Particularly for school-age children who have an autism spectrum disorder, we're starting to move away from adult-guided intervention practices for teaching social skills, and recognition that we really want the kids to be able to interact with their peers, not necessarily always with adults or in addition to adults. And so in the literature, there's been a movement towards what are called peer-related interventions or peer-mediated intervention, where peers in a classroom might identify children who are struggling a little bit socially, and who then talk through how do we best help this child. The interventions sometimes focus on also teaching children to understand what they might perceive as differences, and in understanding why the child with autism might look different to them, they're sometimes more responsive and willing to interact more with the child with autism. Some of the benefits of this is that bringing an adult into a social situation or a play situation with peers can sometimes automatically make the child with autism stand out and look different from their peers. So if peers can be taught to facilitate interaction, it sometimes works really nicely. So some strategies that have been used for things like this might be looking at what the children are playing on the playground, teaching the child with autism that with a few of their peers in a smaller setting. Then once they've learned that game in that smaller setting, bringing them back out and playing it in the larger setting on the playground, and encouraging and getting a lot of reinforcement from their peers for using those skills out on the playground. Some other strategies that have been used are things like conversation starters. So partnering kids up as they walk down to the cafeteria and saying to them, okay, tell them one thing that you really hope you get for lunch today, or one thing that you're really excited about your birthday coming up. So giving them an idea of what to get started on, but partnering them with a peer who's going to be the one who's reinforcing them using that strategy. This helps make the skill more generalizable across different settings, and it's happening in the real world setting of where that child is. I'll also include some resources for some of these peer-related interventions and the guide at the end of this presentation. Some basic principles that apply to intervention in the education environment include these ideas of using strategies that we know work well for young children with autism. So using some of the visual supports that we talked about to help with the areas of difficulty that we know can occur for children with autism, like visual schedules to show what to expect in the routine or how to handle when a change happens. Making sure that the environment, especially for children who are deaf and hard of hearing, is not too visually cluttered so that there isn't competing information with those visual supports that are trying to explicitly teach the child a skill. Using clear language that's at the child's level. So we often talk about using something called the one-up rule. If the child with autism in their own communication is using one sign or one spoken word to communicate, then when adults give directions or are talking to them, we should try to either keep our language at that one word, one sign level, or one up, which would be 2 words or 2 signs. So instead of saying, go get your backpack and sit down right now because it's time to go, saying backpack, go, simplifying the language to where the child is if they're at that single or 2-word level. It's also important to consider, what is the classroom environment like? Is it really noisy and overwhelming for a child who is easily distracted by what's going on in the classroom? And ways we might think about that are either using some of those study carols that are talked about in the TEACH model, or for children who have some auditory access to sound, making sure that the environment is both accessible to them and not overwhelming. So using assistive technology for their hearing, but also making sure there's not extraneous noise, that they're not sitting by a fan or something that's making a lot of ambient noise that might be distracting to them. Using tennis balls on the bottoms of chairs so that there's not a lot of extraneous noise in the classroom that's distracting. It's important to think through making sure that that the child understands what's expected of them in that environment. So some of the visual supports that we talked about, or also social narratives and social scripts can be used for that. I'll include a resource at the end of this guide that talks about the hidden curriculum. So thinking through the social expectations that we all have that may not be obvious to the child with autism, and how do we make those obvious to them? So rules for things like personal space is a good example. How do we teach that hidden curriculum item so that the child with autism can understand it? Some other school-based supports to consider might be opportunities to have more individualized, structured teaching of those social groups, of those social skills. So that might be a pull-out group where a facilitator like a speech-language therapist or a mental health provider teaches a very specific social skill in a smaller setting, and then teaches them how to use that skill in the larger classroom or a school setting or a school building setting. It also is to consider, important to consider the things that we know can be challenging for children with autism and make sure that we have interventions supporting those needs. So for example, making sure that they're getting supports for fine motor difficulties, which can range from specialized instruction from an occupational therapist to a variety of different environmental accommodations that could be used, like having a slant board or using a special grip to help with those fine motor challenges. We also know that young children, or that children with an autism spectrum disorder often have difficulty with something called self-regulation, which is keeping themselves in a place where they're able to regulate their body's needs and their emotional needs enough that they're available for learning. And so there are a variety of different curriculums and strategies that have been used to promote self-regulation. I'll again include these resources at the end of the presentation, but some of them include things like Carrie Dunburn's The Incredible 5-Point Scale. They also include things like the Unstuck on Target curriculum.
A young boy is pictured on the cover of the Unstuck and On Target curriculum with the title, An Executive Function Curriculum to Improve Flexibility for Children with Autism Spectrum Disorders Research Edition.
Another associated symptom, difficulty that might require a targeted intervention are some of those symptoms of anxiety that that are more commonly challenges for children and adolescents with autism, especially as they approach adolescence. So there are interventions that have been developed specifically for those difficulties, like a curriculum called Facing Your Fears, which uses cognitive behavioral approaches to treating anxiety. That was specifically developed for children with autism. These types of curriculums can often be modified for children who are deaf and hard of hearing. They tend to incorporate more visual supports than the typical interventions, but there may still need to be some work in translating some of the concepts, for example, to sign language, and in making sure that the children have an understanding of the vocabulary that's assumed to be shared knowledge in these curriculums. So some pre-teaching might be necessary. I'm going to shift gears a little bit and talk specifically about intervention with children who have reduced hearing as well as an autism spectrum disorder. As I said at the beginning, we really don't have much evidence about the effectiveness of any of the interventions that I previously discussed with children who are deaf and hard of hearing specifically, although they've shown effectiveness with children who are hearing. Most of what's out there is case studies, and so we have a lot of work to do in terms of understanding what interventions are going to work best with children who are deaf and hard of hearing, or whether it's better to develop novel interventions with children who are deaf and hard of hearing, or whether we can modify the interventions that are commonly available for use with children who are deaf and hard of hearing. Currently, it seems reasonable in a lot of cases to take interventions that have been used successfully for children who are hearing and modify them for children who are deaf and hard of hearing. However, being able to do this requires an understanding of both the autism intervention and what the needs of, what the unique needs are of children who are deaf and hard of hearing. In a lot of cases, if the child communicates primarily using sign language, then of course it's beneficial if the individual administering the intervention can administer it directly. If not, then it requires a lot of, if that's not available, then it requires a lot of communication and collaboration among the child's providers to be able to work with an interpreter in providing that kind of intervention. And that's a unique aspect of intervention that we really don't have much. We really don't have much research about how bringing an interpreter or somebody who isn't able to communicate directly with a child impacts the benefit of the intervention. I do want to talk specifically about the idea of intervention for communication for children who are deaf and hard of hearing who also have an autism spectrum disorder. So one thing that we know among hearing children with an autism spectrum disorder is that even though language deficits and delays are not actually considered a core symptom of an autism spectrum disorder, so that is that a child could have an autism spectrum disorder even though they're able to speak fluently, right? If we look at the population of children with an autism spectrum disorder, they're more likely to have language delays overall than their typically developing peers. And we've seen this to be true in children who are deaf who have an autism spectrum disorder as well. So Dr. Aaron Shield has a sample of children who are deaf who communicate using sign language, who were previously identified with an autism spectrum disorder, who also have deaf parents, where it can be assumed that they have good language role models, or where we're assuming that they have good language role models in sign language. And even among those children who had language in their home and school environments in a visual modality like ASL, 1/3 of his sample of children who were deaf, who had an autism spectrum disorder, also had delays in their language, in their sign language. So just like for hearing children, where being in an environment where you can hear language, if you have autism, doesn't necessarily mean that you're going to be able to understand and use the language in your environment. Even for children who are deaf, who use sign and are in environments where sign is available to them, if they have autism, they're more likely than their typically developing deaf peers to also have language delays. Okay? We've previously thought in some interventions for hearing children with autism that we could use sign as an intervention for treating autism, for encouraging them to be able to communicate. And it's shown some benefits. However, just being exposed to sign language for hearing children or deaf children who have autism is not in and of itself sufficient intervention. We have to work much more systematically at building some of the other skills that are necessary to be able to understand and use language. And the social difficulties that are associated with autism definitely come into play here. So being able to build communication skills for children who have an autism spectrum disorder, who are deaf and hard of hearing, requires not just making language accessible to them, but building their attention to language within their environment, so their eye contact to be able to perceive and attend to visual communication in their environment. It also requires building some internal intrinsic motivation and understanding that communication in whatever modality, whether it's sign or spoken language, is essential, because children with autism sometimes are not intrinsically motivated to communicate with others. So we have to target our interventions there. As I said before, it's also possible that some of the difficulties that are unique to autism that in hearing children interfere with their ability to acquire language, like poor imitation skills and poor motor skills, can contribute especially to difficulties acquiring sign language for children who are deaf and hard of hearing. So just because the child is exposed to sign language, if they have imitation difficulties or motor planning difficulties, they may not be able to produce those signs accurately and may need some other strategies to help support their ability to communicate, like AAC, as we discussed before. So we really have to focus on making sure that we're building functional communication. A lot of times in deafness especially, there's been a lot of controversy around modalities of communication, when whether the child communicates using spoken language or sign language, that is. And when it comes to thinking through autism intervention, we really need to make sure that we are attending more to whether they have functional communication, regardless of what that modality might be. Because for many of these children, the modality with which they understand language might differ from the modality with which they're able to produce language. So when I speak about function of communication, you want to think through, does the child have the ability to understand the language that's in their environment? Is it accessible to them? And from a perspective of reduced hearing, we have to think through whether there's visual supports for their language, whether we're making, for children who use some auditory access to communication, we have to make sure that we're using technology and other environmental strategies to make sure that we're optimizing their access to communication. In terms of the child's communication, when I'm talking about function of communication, I want to make sure that they can use language for multiple social purposes. Can they use some strategy to get attention, to request from other people, to protest when something's upsetting to them or they don't want it, to greet, engage people socially, show affection, to comment on things, to confirm like yes or no, to ask questions, to direct others' attention to what they want, like look or come here, look at this. And so sometimes our interventions stop short of meeting all of those different varied social functions of communication, and we need to make sure that the intervention is targeting each of those areas.
Title: Interventions for Autism Spectrum Disorder with Children Who are Deaf, Hard of Hearing. Deborah Mood, Ph.D. Ph.D. licensed psychologist. Part 2. This has been a production of CSDB Outreach Programs. Logo, Excellence in Service, Colorado School for the Deaf and the Blind, established 1874. Learning, Thriving, Leading. 33 North Institute Street, Colorado Springs, Colorado 80903. Telephone 719-578-2100. www.csdb.org.